Good afternoon. I'm Jana Martin, Chief Executive Officer of the American Insurance Trust, known to most of you simply as the Trust. We're delighted that you're able to join us virtually today for the next webinar in our virtual webinar series. The Trust is pleased to once again partner with Drs. Margot Adam Larson and Sarah Smucker Barnwell to present these telehealth community chats. They've done a tremendous job with this series, and I know I and our policyholders appreciate their expertise and the time and effort that goes into putting these together. This credit can be combined with 5 other CE credits from any of our other live or on-demand virtual webinar series to save 15% on your trust-sponsored professional liability insurance policy. I hope you enjoy and benefit from our telehealth chat today. Please join me in welcoming again our esteemed presenters.
Thank you so much, Dr. Martin, and thank you to the Trust for having us here today. Margot, it is always a pleasure to have the opportunity to speak with you for our telehealth community chat. I can't believe it's the 13th one.
I can't either, and thank you, Dr. Martin, and I am so pleased to be here today and chatting away with all the new developments and the next things that we're going to talk about from this quarterly chat. I think it's nice to know that we can get back together quarterly to catch up on things.
Wonderful. Well, as always, we will spend today thinking about some practical how-to information related to telehealth, always from an ethical perspective and thinking about how clinical practice can be evolving to meet the ever-changing demands of our practice landscape. We have questions submitted in advance and live. So Margot and I have pre-selected several questions that we thought were really great and representative of the concerns that folks had brought during our last chat. And then, of course, we encourage folks to enter questions into the Q&A, and we've allocated time today to try to get to as many as we can, though unfortunately, we do not always get to all of them, but we can always save them for next time.
And I would add one more thing. We do peruse through the evaluations to gather the questions that folks have from there. So some of the things that we have on our topic list today have come from that as well. So another place to plop some questions for us for next time.
Many roads to being included in the telehealth community chat question log.
Absolutely.
Well, let's get right into it. We had a great question last time, and this is very relevant to folks who particularly might be practicing across city boundaries or even interjurisdictionally among states. Are there business tax laws or ramifications for psychologists offering telepractice into a different jurisdiction?
This was a fantastic question because it really covers an area that we have not chatted much about, which relates more to the practice, kind of business practice side, not necessarily the clinical practice side of telehealth. And I think a very astute viewer was just really curious about what happens when you may be licensed in multiple jurisdictions, providing services in multiple jurisdictions, and if there's any tax ramifications or any business law ramifications that we may need to consider for that. And so I think a great topic to bring up. Like many of our topics, we don't necessarily have a specific answer for any particular scenario of one jurisdiction into another jurisdiction. The real things to contemplate here are a few things in thinking about your taxes and getting good licensed, CPA based information. So connecting with either your current accountant or an accountant knowledgeable in the type of practice that you provide. And you may need to connect with an accountant in that other jurisdiction as well, because your accountant may not know that if they're located in the same state you are. So that was the first thing that came to my mind, is just making sure that you've got somebody knowledgeable about the taxes in terms of filing and requirements in those jurisdictions. The second piece of that is being aware of the tax law. And generally that might be an accountant question, but it may also be an attorney question, because there may be some business considerations in different jurisdictions that you need to pay attention to. Historically, there have been jurisdictions that have required you to file with the Secretary of State, for example, if you are functioning or doing business within a jurisdiction. And so finding the answers to that through a legal referral or a legal consultation will be really key. So those were some of the things that came to my mind as I was reviewing that and thinking through. How about for you, Sarah? Anything that you would add to that?
I mean, everything you said, Margot, absolutely. I would, as it happens, in the last month or so, I had this very question arise in my practice where I live, wherein a provider was moving, and they were having their practice in the neighboring state. They were going to continue a telepractice. They were dually licensed in both states, and they wanted to well understand what the tax laws would be. And of course, I'm not a tax attorney, so we set forth to learn some of this information together. So we did. She did contact her CPA, who was very helpful. She also consulted a CPA in the new jurisdiction where she would be living. The only thing I would mention is, in addition, we contacted the city and state licensure holders, the mechanisms. So in this case, it is the State Department of Revenue for my home state, as well as for the neighboring state, and then the city licensure mechanism, and inquired with them. And we learned some interesting things. And again, we can't say this enough. These things vary so much by jurisdiction. It's really important to learn what the information is for your home state and for the states you practice into. So there's no one size fits all. But I would encourage call the offices that send you the tax bill, because they have a vested interest in this being done correctly. And what we learned, which I thought was very interesting, was that there were, in some instances, certain thresholds wherein if you practice under a certain amount, a dollar amount, they did not require registration. Whereas if you went over that dollar amount, they did. Not unlike the issuing of, I believe, a 1099 for federal taxes. I think if you're under $600, they say don't fuss, don't bother. If it's over, they say do. They similarly had a similar mechanism at the state level. So this is relevant. If I had one patient I saw one time in a place I was a distant jurisdiction where I was permitted to do so, either through SIPACT or through dual licensure or some other mechanism, maybe that's different in that jurisdiction than if I had a regular practice going into that jurisdiction. But again, we're only going to know that when we contact the CPA and we contact the state governing body that sends us the tax bills. So that's the only thing I would add, is that call the folks who get the taxes. They will have an opinion.
And I guess I would add to that too, it's better to find out ahead of time than after the fact, right? So not to dissuade people from doing this, but really to give you, maybe think of this as a little added challenge of something more to look into as you're looking into interjurisdictional practice, that there are a few other nuances that you may want to really evaluate to make sure that you're kind of following what the flow is and what the requirements are.
This is perhaps a permission rather than forgiveness situation. But if you're in a place of needing forgiveness, I'd say still contact them and see, what the next steps are.
For sure. And I wouldn't avoid that.
Yeah.
Taking care of those things ahead. So again, that was an awesome question that came in through emails. So thank you for that. I think the next question is one that we have had several times come up in our chats, and we thought maybe good to just dedicate a little time today to really revisit this concept. And the idea of explaining SIPAC or an e-passport, what that really means. Is it, only about where the psychologist is located or where the client's located? This is not an unusual conundrum that is a common question. So I thought, let's chat. What are your thoughts on this, Sarah?
Okay, so I did my homework to make sure I could come with a concise definition. This is my best effort. So PsyPact, which is the Psychology Interjurisdictional Compact. This is actually not new. This was approved by the ASPPB Board of Directors in 2015 and was fundamentally created to help facilitate both telehealth as well as temporary in-person practice across of psychology, I should say, across jurisdictional boundaries. So PsyPact is fundamentally an interstate compact, not unlike our driver's license or other things that facilitate interstate agreement, which is an agreement between states to enact legislation to enter into a contract for a specific limited purpose or to address a policy issue. And in this case, the issue is providing telepsychological or temporary in-person psychological services across jurisdictional boundaries. So there are two fundamental mechanisms of PsyPact that I'm going to dig into momentarily that we'll talk about: the temporary authorization to practice, or you'll sometimes hear it called the TAP or TAP, I suppose, or the e-passport. So we'll get into that momentarily, but I'll mention there are 27 member states currently with enacted legislation for PsyPact. There are 5 more states that have effective legislation that's soon to be enacted. And then there are 2 states with proposed legislation. So this is getting some real momentum, getting some really substantial membership. A really notable, relevant question, and this is something Margot and I had to go to school about, we had to go learn about, but is you must live, and when I say live, your business must be located primarily in a member compact state. So if you were someone like me, I happen to live in a state that is not a member of PsyPact, which makes me so sad. And if you wanted an e-passport, which I do, you cannot get around this by saying, oh, well, I'll go get licensed in a state that's a member state and get my e-passport through that license. Unfortunately, that's not the way it works. You have to be in the state that is the member state in PsyPact. So, but apparently we have 27 chances. So you got a 50-50-ish shot. Okay, so let's talk about the 2 major mechanisms of the PsyPact. So we have that temporary authorization to practice, and this fundamentally is allowing you to conduct temporary practice under the authority of PsyPact interjurisdictionally. So you could actually physically go to another state temporarily and provide services as if you have this temporary, this TAP. Now, if you wondered how I get this, how do I apply for these things, you can go to the ASPPB website. It's pretty straightforward. The requirements are pretty forthright and not too terribly complicated. And then once you have that, you're required for, it's a time limit of 30 days per calendar year in that PsyPact state. So you can practice up to 30 days. Now that's 30 days of practice, not 30 days in a row since the day you practice. You can have up to 30 practice days with that temporary practice permission. Okay. But I want to spend more time talking about the e-passport because this is a telehealth community chat and that's what we're about. The e-passport is a really exciting mechanism that facilitates telehealth by allowing psychologists to practice interjurisdictionally when they register in that PsyPact compact state and they obtain this e-passport. Again, if you want to learn how to do that, go to the ASPPB website. They lay it all out for you. It's very straightforward. And there's no time limit on it. This is an unlimited time as long as you're in good standing with that e-passport. So essentially, it is allowing you to practice interjurisdictionally only to member states, though. So if I lived in a member state and I got an e-passport, I wouldn't be allowed to practice into any state everywhere, but only those states and provinces, excuse me, I should mention, Canadian provinces and United States, that are members. And so we can do this in this way by going within, excuse me, I should mention that this is only for United States, folks who live in the United States, you can only be practicing into other United States. So you have to stay within your country, but does not facilitate international practice. This is practice that is strictly interjurisdictional among states. I think that's my brief synopsis. That wasn't so brief, huh? Anything you would add to that, Margot?
Well, I think a couple key points. The first relates to where you are doing business, right? And that's that state you live in. And that really ties in with our first question about kind of business law and, how are we doing business? You may have other questions related to those states you might be practicing into if you are lucky enough to be in one of those compact jurisdictions. And I think The other thing I would add is just that big distinction between temporary in-person practice, which is actually physically, moving or traveling to another state that's in that compact to do work, versus the telepractice, which is, like you mentioned, unlimited. So you have physical days of 30 throughout a calendar year, and then you have unlimited with the telepractice side of things. So hopefully that kind of maybe clears things up, but also might raise a few more questions in terms of, just that process and how that flows for folks. There are a lot of people that have taken advantage of this, and the states and jurisdictions that are signing on to the compact are growing with each legislative session around the country. And so the ASPPB has a great website that will connect you with the jurisdictions that are participating. And I know that's another really big question that comes in a lot is, from how do I know which states I can practice into? And that is one of those links that you'll find on the resource slide to really go back and revisit, because what you might have looked up 2 months ago may have absolutely changed because there's new laws taking effect each month. And so it's something you need to keep looking into and keep checking on. It's not just a one-time call and a one-time answer. Things change. So just to make sure that you're up to date on everything and keeping up to date.
Great points. I'm seeing a few comments in the chat box to ask us to spell out ASPPB, which is the Association of State and Provincial Psychology Boards. ASPPB.net, I believe, is the website.
Awesome. We've had a number of really great questions coming in while we've been chatting about this first portion of the chat today. Should I throw a few out at you?
Let's do it.
All right. One of the first is I think a really intriguing one, and it has to do with folks who are conducting assessments and having concerns about third parties. I will presume that's insurance company third parties, but maybe not, requesting raw data. And apparently APA's issued a decision to relax some restrictions on that. And so folks are just wondering what advice we may have to mitigate those risks. And maybe more specifically, if we know anything about some of the changes that might be coming down the pike for protecting raw data. So any thoughts on that?
Well, transparently, this is something that I'm going to have to go do some homework on, and I would love to bring to the next chat. I would think that if it depends, so much of this would depend on where and how we are administering those assessments. So, if we are administering them through a secure third party database, then the insurance has to has to specifically request that data. I've heard some folks, I hear tell that some insurances require the psychologist to use a certain platform, inclusive of test administration platform, in which case they would have unlimited access to that data. So I agree that there are tremendous confidentiality and privacy concerns, regarding releasing raw data that's not easily interpreted by a layperson. I have to admit, this is something I need to go do some homework on.
As you're talking about that, I'm also thinking about a couple other factors related to trade secrets for the test companies in terms of what the content is and what exact data we might be releasing, and if that's on forms or has any protocols related that are printed and published by the test company that would be falling under their protections. That's one thing to think about. How you store that data becomes something you want to contemplate as well, given that we're kind of in the digital age and storing a lot of things digitally, and who has access to that. And are you storing them on a platform? Are you, providing them to the insurance company? Those are all important questions. And I think the other piece that I would also think about is really the reason for why you're using the assessment measure. The clinical reason you may be using a tool that you're kind of conducting maybe continually or updating continually for a purpose may not be necessarily what that third party is thinking it's for. And so making sure that the documentation is there supporting what your purpose is for that assessment and how or where it might be used, and covering that in your documentation can be really helpful for making it not as useful to others down the road. So to
I think as you're speaking, I'm just thinking like so many parts of the patient record, I would probably be inclined to be a curmudgeon here. And when someone comes asking, unless it depends on what they're threatening, I suppose, but, without legal, requirement to do so. And I don't know how this impacts reimbursement and some of those themes, but my instinct would be to say no, to not unlike when insurance companies ask other parts of the details, unless it is necessary for that client to receive coverage, my default is to say no and to discuss it with the client. But that's a very principled perspective, wherein that may not be an option. If someone is saying, well, then the client won't be covered, then, that may have to be negotiated further.
Yes, I think simply just turning over information and raw data because somebody has asked is probably not the solution right away. It's something really.
It sounds like APA has, opined on this. And so this is where transparently, I need to go get smarter. I need to learn a little bit more about this. And so I'd like to come back to our next chat and have a more formal opinion and familiarize myself with some of these policy shifts, because that one, I don't know. I saw one that was good as well in the chat, and it was related to telesupervision. They said they had not yet tried telesupervision, but, they were sort of asking, what do we think about that?
Go ahead.
I was going to say, I definitely have an opinion on this one. Telesupervision, I'm a tremendous fan of. We always want to check in on the Committee of Accreditation's implementation regulations has some guidance for supervision, how much can be remote versus in person. I want to acknowledge in the context of the pandemic, much of that has been upended. Our expectations are on what happens in person and remote, but in the before times, there was a concept that only a certain percentage of supervision would be remote. And that has been very much challenged and changed in the pandemic. But historically, we want to be thoughtful about what percentage. We want to make sure that the person receiving supervision is practicing in a jurisdiction where we are licensed for doing telesupervision, or if we are practicing, that our supervisor is licensed where we are practicing. But I do think it's an amazing mechanism through which we can gain access to the type of specialty supervision that we might not otherwise have. So if I'm living in, a rural area and there just aren't that many geriatric neuropsychologists from whom, I can receive supervision, perhaps telehealth is one way that I can gain access to that clinical specialty and help increase my competencies in the way I'd like them to be increased.
Sarah, I actually just put a timeline together for a different presentation talking about the timeline of telehealth. And one of the earliest uses of telecommunication early on in military, way back in even the Civil War, was telegraph, Morse code type exchange of medical knowledge and information back and forth. And so I think this is an intriguing question because probably we've been doing telehealth supervision for a much longer time than we really think we have. Those phone calls to our supervisors, those are all aspects of telehealth that I think we can certainly lump into this category. But like you mentioned, there are certainly educational requirements and licensure requirements that we want to be cautious of if this is pertaining to, educational training programs. Certainly consultation and supervision and the licensure factors play a role there. But like you are mentioning, telecommunications, telehealth has allowed us to access specialty consultation and supervision like never before. And I think that's pretty awesome.
Absolutely. Well, I'm looking at the time, and it's always really tempting to dive into the questions, but I'm going to suggest we return to some of those that we pre-selected for today.
Absolutely. Absolutely.
We had a great one, which was, can we have a list of telehealth informed consent best practices? Why, yes, we can. I think it's going to show up in the chat. The trust is actually created in their forms library. They have some wonderful options, inclusive of an informed consent for telepsychology, template that you may use and customize for your own practice, an informed consent for return to in-person care. Because again, it used to be the default assumption and we'd be treating folks in person. And then this last year happened and that assumption was upended. So now for many of us, as we return to in-person, if we decide to do that, we can really help folks understand what are the risks, what are the obligations, what are we all agreeing to in meeting in person. Informed consent for walk and talk therapy, which is really relevant. If we decide that the way we want to handle our current situation is to be outside with patients. Well, that comes with unique concerns, risks for privacy and confidentiality. So in addition to those resources, I would also mention that the trust is now offering a telepsychological competencies credential, which is a program of study that actually walks us through those benchmark competencies to really make sure we're practicing ethically, appropriately, and within the law. So the TCC, which is its snazzy acronym, will be another place that will have just a tremendous amount of resources. That's one-stop shopping that has resources from both the trust as well as the National Register. Outside of that, I would mention the American Psychological Association, as well as ASPPB, which we mentioned a little earlier. Both of those websites have tremendous resources for telepsychology, inclusive of, for American Psychological Association, does have some informed consent templates that you could also take a look at. And these are all free, on the website. The form library and the American Psychological Association have many things you can just take a look at, peruse, see if they might fit your needs.
I love too that they're growing. When we first started on our first telehealth chat, the trust had a good list of resources, but it has really blossomed over this year. And I think thank you to a lot of our colleagues who have been contributing to that. And like you mentioned, don't just kind of download it and go, okay, now that's what I'm going to use in my practice. You want to really review that and make sure it fits with what your specific needs are. And just looking through the questions, folks want to know what works for my particular situation. And the best person to know about that is you. And if you have more questions, then reaching out to the risk managers to really kind of fine tune some of those needs or issues that you have can be really helpful as well.
Absolutely. Okay, well, we received a question that had us go to school, Margot. We've received a lot of questions, over the last few sessions about themes of HIPAA and vaccination and reopening. When can you ask? Who can you ask? And I really want to pause and give my thanks to Dr. Julie Jacobs, who is both a psychologist as well as an attorney, who was just fabulously helpful and instructive and took some time to speak to us at length about this issue.
Yeah, this is kind of a really big topic these days, right? And I think we saw that kind of blossoming in the last couple chats we've done, and really thinking about, tackling this topic from a couple different perspectives. And I think the first one is maybe a bit more straightforward in terms of patient vaccination status and how do we manage that data? And because it's a patient, that would be no different from any other kind of HIPAA related data. We would use the same storage techniques. We would document it in the same way. We may have asked for other kind of, particularly in child work, we may have asked about other vaccination status, or maybe there's other topics like that from a medical standpoint that we've asked about before. So that would really be no different. What we do with that information, however, may be something different in terms of why we're asking now. Are we asking because we want to have some perspective in terms of returning to inpatient care? Are we asking to make some determinations about, the feasibility of that, or continuing accommodations for telehealth practice? So it's that second part that we really want to have more clarity on from an ethical and a practical consideration.
Absolutely. And as you say, we're accustomed to handling sensitive information that is covered under HIPAA, when interacting with patients. And this is part of our usual practice. And, I really want to emphasize this point because I think it's an important one that you made, when I'm intuiting. And that is that we have the right to make determinations. So we may decide that I ask you this question about vaccination. I may make a decision about what to do with that information. So I may decide that indeed I am at this point doing only telehealth, or I may decide I'm only doing in person, but if I am going to make the decision that I wish to work with clients of a certain vaccination status, I need to be thoughtful about offering reasonable accommodation. And this is kind of a theme we were talking about. We have the right to set some boundaries to make some decisions, but we do want to be thoughtful about how we take care of all of our clients that we have an ethical mandate to care for. And this is where I think telehealth has a very significant role to play. A reasonable accommodation that we can offer if someone says, gosh, I'm not vaccinated, that's not something that's going to happen for me. We may make that decision and then offer them telehealth, as a way to continue their care uninterrupted and make sure that they continue to be able to be seen. So I think that this is a really important piece and something that I was interested to learn, that yes, we do have the right. We always have the right as psychologists to make decisions about delivering care or not, but from a perspective of equity and making things fair, we have to make sure that we are available to accommodate. And telehealth really emerges as a way we can do that. Now, for somebody like me, I'm exclusively telehealth, so it's pretty much the same, irrespective of your answer to that vaccination question. But I do want to, enforce the ways in which we do have some decisions to make about what we do with that data.
I think that kind of rolls into the next aspect of maybe some of the tricky questions related to vaccination, and that is about asking the status related to our staff, employees, or if we're an employee being asked about our vaccination status and how that may play a role in how we move forward in our practice. We have a variety of states having very specific determinations about requirements related to vaccination in certain employment settings and by certain classifications of employees. And so I think this becomes a bit more of a kind of a really, let's think about why we're asking and what we're going to do with this information. It's not HIPAA information in terms of something we have to protect in terms of employees. Even though we're used to keeping HIPAA information and we think it might be HIPAA information, we're not their care provider. So that kind of takes it out of that role of HIPAA. However, it is still the employees or our staff's health information. We want to be cautious and thoughtful and really contemplative of those questions or the reasoning behind, why are we asking for that information and what are we going to do with it and how are we going to make determinations or decisions following that.
Yes. I mean, and you raise a good point, is it may not be HIPAA. There may be other employment laws that prohibit us from telling our, employees' health information to everyone, but I do think HIPAA gets trotted out these days as sort of a panacea, for all things, and that that's not the relationship we have with our employees, but nonetheless, we are required to safeguard that information, but we are allowed to ask. And indeed, as you note, it's always relates to your jurisdiction, right? Your state. So in some states, you may in fact be required, to only allow people who have a certain vaccination status to work, within your company. So I know in many instances, healthcare workers are required to have vaccine in many states. And that includes outpatient mental health providers or inpatient mental health providers. And so it also can be determined by an entity totally outside of us. We may have whatever opinion we have on it, but we may be required by our state Department of Health to ensure that our employees of our business have a certain vaccination status.
And again, we're here to talk through the contemplations and the ethical considerations and not necessarily have a specific answer for your specific conundrum. And the one thing that I think is really important to consider is, the questions out there, and having a plan of action and a thoughtful consideration from an ethics standpoint will be really key in how you manage that information or manage that situation as it comes along for you and your office and perhaps your staffing situation, if it hasn't already been a question that's been raised. So thinking ahead on this and not avoiding it is really key. And also kind of that consideration of, what information you're putting out there related to your practice, and is it okay to even share that staff information from a more public perspective? So I think those are all pieces you're going to want to really think deeply about.
I've heard, I appreciate that. And I look to like, what are the unique requirements of your state, your jurisdiction. So I've seen on some practice websites here in the state I live in, it happens to be the case that all healthcare workers are required to be vaccinated. And so I've noticed on many practice websites, what's popping up is not a comment of, well, everyone's vaccinated, or these people are vaccinated, or these ones are. There's just a statement that says, Washington state requires da 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 da, and I think that that's an interesting way to handle that. They're just sharing something that is public information. They're putting it on the website. And in some ways, I think they're hoping to address people's concerns without releasing information they ought not to.
Yes. And it's, of course, and it's going to be an ongoing kind of rolling situation. So we'll keep monitoring on our side. And certainly I anticipate we'll have more conversations on this topic in our next one.
And because we are psychologists, I want to pause and acknowledge the human awkwardness of these questions. I'm not necessarily opining as to how to manage it, but I think it is, who, if not we, can have some of these hard conversations and ask these awkward questions. There's a certain humanity to it, of just this unprecedented place we must all tread as we are figuring this out. And I think I often feel like I am called to use my clinical skills in those moments.
Absolutely. We've had some amazing questions coming in. Should we turn to them for a few more minutes?
Absolutely. Let's see. Okay. So I saw one I thought that was very interesting, relevant to the VA, and I'm just trying to find it, excuse me. And they were specifically asking about the VA and interjurisdictional practice. So they said, are VA systems held accountable to state licensure requirements regarding across state lines, telehealth, and psychotherapy? And what about malpractice considerations for individual licensed psychologists? After all, states, not federal governments, issue psychology licenses. And
an excellent question.
Very. I'll share with you what I know, and it's limited. So, in ye olden times, there was a notion of federal supremacy and licensure mobility, wherein they said, well, there's this concept that we are working for a federal entity, so we are less concerned about the interstate licensure, for VA employees. I will say that has been under much consideration, and it's something I know the Attorney General of the VA has been looking at very closely. So it's something that is ongoing, and that's probably why it's hard to get a straight answer, is I think this is being figured out. For the most part, my understanding is of late, they have tried to stay within jurisdiction when possible. So when possible, within the VA system, they're trying to have you licensed in the place you're practicing. Now, again, I think that when you're thinking about VA, there's kind of this hub and spoke model wherein they're often serving areas that have, might be quite remote or rural. I know I personally once at one point was working into a clinic in rural Alaska, many, many miles from anything, much less a mental health clinic. And so I think that patient population does have some unique challenges. And so I think probably that's where the challenge comes from, is that they are really trying to meet the patient needs. That's the priority. And they have some pretty unique concerns. But I think it's something that is still ongoing, still under discussion. With regard to malpractice considers, but I will say, that it is regarded generally as something that historically VA has negotiated this with allowing interstate practice, but I think it is something to keep an eye on. And I would encourage you to call your home state Department of Psychology and ask them this question, because oftentimes that they will have been in communication with the local VA system and have an opinion to offer.
A piece, Sarah, I would add there is the consideration that we're talking about with practice within the VA system.
Yes.
There may be times where folks are located in a state where they may want to practice not from a VA standpoint, but have a side practice or something like that. And so we're not talking about our response in that regard. We're really talking within the employment setting of the VA system. Anytime you venture out from that, you are going to fall under the same licensure requirements as anyone else in that jurisdiction, and or if you're practicing into that jurisdiction. So all of our previous comments would apply for that.
Very good point, and absolutely right. I can't just hang out after hours in my VA office and see some on the side telehealth patients. They won't. They wouldn't smile on that. And there's a question about supplemental malpractice insurance, because the VA does typically have malpractice insurance that is provided to its employees. I will say that I know I did when I was a VA employee, and I'm not saying it's necessarily the thing, it's an individual choice, but I actually did seek supplemental malpractice insurance because, I wanted that peace of mind. I think it's something, what I would do is I would look at what the policy is, what is the policy that you were given? What are the limits? What are the features of it? And then I would shop it, look and see, okay, well, can I compare this to something commercially available and see what the features are? What are the limits of coverage? Will I be defended if I needed to have a defense, legal defense? Will I be covered if complaints are made years later after I leave practice? So I think these are things I would want to know and making that determination of whether or not I'd want supplemental insurance.
I think that's always great to really look into those coverages. And again, I would say that same comment, if you're practicing within that employment setting, what is your malpractice coverage and who has purchased that policy? And then if you're practicing outside of that setting, what's your coverage and who has purchased that policy?
Right. Okay.
I am just blown away by all the questions that I keep scrolling down. So I am really excited actually for our next chat, because we've got so many here we're not going to get to, but we'll bring them back for the next chat. One that jumped out at me had to do with kind of a thing that's, I think, on a lot of people's minds, and relates back to our conversation about vaccines. And somebody had asked, do we have to wear masks if we're going back into the office setting? And so, gosh, that's another one of those, nobody wants to answer that question.
So let's do it.
So let's go.
So this is one where I would, again, and forgive us, we're at a bit of a broken record on this, but like I would go, Margo, I think you and I probably would both advise a person to go look at what your local jurisdiction requires. So some states have very explicit requirements for masking, particularly in healthcare settings. So that would be my first stop, would be to understand what is Department of Health advising in my state, what are the legal requirements to make sure I'm in alignment with that. If there are no requirements for that and it's just up to your, due diligence, then I think that to me is like definitely part of the informed consent conversation, having for that return to in-person with clients. are they going to wear a mask? Are they comfortable wearing a mask? Do I want to wear a mask? I will say, anecdotally, many colleagues have mentioned to me, oh, I'm staying with telehealth right now because, where we live, masking is required for healthcare circumstances. And they say they would rather do telehealth than to do therapy with the mask. And I think that's an individual choice. So I think I would be thinking about how comfortable am I doing therapy with a mask? How comfortable am I asking my clients to wear a mask? And, can I have that part as my informed consent conversation? And also, what are my boundaries around it? If I do decide, oh, yes, I would like to wear a mask and I'd like my clients to wear a mask. And, I have a client who says, oh, I'm sorry, I just can't do that. Then what am I willing to offer? Like, am I willing to offer telehealth as an accommodation? Am I not? I think these are things you want to think through beforehand to kind of have your decision tree in line.
And it's going to be one of those changing ones. And I would just add that it may not even be at the state level. You may have local public health departments in a county even that is making different requirements from the county next door, depending where you're located and the state. And those may be changing daily, weekly, monthly. And so thinking through all of those things that you mentioned is really key, as well as how quickly can you change back or take a different route in terms of care if the requirement tomorrow changed. And so it's that, how do we kind of pivot and roll with that movement? So
I also feel like there's a meta conversation to be had at this moment, about vaccination and masks and breakthrough. And, it's still very unlikely vaccination. If you are vaccinated, your patient's vaccinated, what they say, and anecdotally, many of us are, knowing folks who are having breakthrough cases. It's in our communities. And so, I think that this is a factor. I don't know about you, but I am taking fewer things for granted. And I'm really trying to think through things, and just kind of have some policies that work, that are flexible, as you say, because what made sense at that time may not make sense a few weeks from now. We may learn something new. We may get in there both with our masks and good intentions, and find that, oh, this just does not feel very good. Or we may get in there without masks and find ourselves, deeply afraid, whatever the case may be. Having that flexibility and that latitude, I think, allows folks to benchmark expectations that things are going to change.
Yes. Do we want to continue with some questions or move back to some of our previous questions? I'm just looking at our time.
Yep, we have 9 minutes. We had one question that we earmarked, one additional question that we earmarked. I think we could do quickly and then maybe catch one more question that people have submitted.
Sounds great.
Okay. I thought this was a really funny question and I liked it. Is, what's your typical day like now? I thought, gosh, I would love to hear the answer of everyone who's at this talk. Like, what's your new normal now? And so I tried to think I would say mine succinctly. I am in clinical practice. I am 100% remote. Ironically, I go in person to the administrative parts of my job. So in addition to seeing patients, I'm a executive clinical director of a practice. And so I have to go in and make sure everything's okay. So I do think there's a certain irony that I'm going in person to like straighten the coffee cups and things like that. And like many people, I'm juggling this with figuring out the ever-changing landscape of schooling in the context of pandemic. And some days are homeschooled and some days are at school, and every day is National Kumquat Day or something funny. So, it is, I think for me, it has required a great deal more flexibility and a great deal more investment in my, I have a really nice, you wouldn't know it at this moment because it's currently being organized, but a nice home office. I have a lot better equipment, better lighting, better sound than I did previously, because I really recognize this is here to stay. It's the way it's going to be. And so I've invested in that. And that's what my average day looks like. And I wanted to add in, I have a lot better dinners now because throughout the day I throw things in my Instant Pot. And when 6 o'clock rolls around, dinner is pretty solid around here where it did not used to be.
I love that. I love the question came in now, because I would say a year ago, I'd answer this question entirely different, actually. And so interestingly, all of my practice currently is 100% virtual. From my generally office setting, although I will say I now have 2 office settings, actually multiple office settings, but I have one at the practice office. I have one at my house now. And so I have a lot of fluidity between those 2 settings, but in general, I felt a lot more flexible in terms of just kind of how my day can flow and being able to have, more options in terms of, where I see folks from, but either way, they're within one state and my patients are all within one state. So I'm not interjurisdictional in terms of telepractice. Like you, there's been a few things that have changed in my world. I now know how the grass grows in my backyard after staying in my home office with a gorgeous window. And I now really appreciate the window a whole lot more because my practice office does not have one. So I really choose to get out and take some breaks for myself within my day, which I haven't typically done before. So I think those are a couple things that I've learned through this wonderful adventure.
It's a time. I would love to hear people's stories if they feel like putting it in the chat. I am fascinated by how our lives are different, in our professional lives and life in general. Well, we have 5 minutes, Margaret. Should we try to answer one last question?
Let's go for one. Have you seen one that you
did?
saw?
Yes, someone mentioned platforms like BetterHelp have subscribers throughout US, Canada, Europe, and Africa. I provide services to some in each. I'm in New York. What should I consider? And I think this is a great point because this is the wave of the future. I think we're going to see just continued growth in this sector of the market of just large scale telehealth companies recruiting providers to participate. And I think the thing you want to think about is where are you practicing and are you licensed to provide care there? There was kind of a famous circumstance where one of the biggies, and I won't call them out by name, but routinely told people, go ahead and practice. We'll cover you. We'll pay your legal defense, if that occurs. And I was always sort of like shocked by that because, well, if they lost their license, that's not good. And I don't know how they pay them for that. It is ultimately, if a complaint is brought against your license in the state, we have to have 2 feet to stand on to say why I was practicing where I was not licensed to deliver care. And I've heard it said that you're more likely to get in trouble interjurisdictionally than internationally. Go listen to the Risk Management Roundtable chats when they talk about international practice. I think they've opined really beautifully and thoroughly there. But at the end of the day, the question is, are you licensed to deliver care to where you're delivering it? And I know a lot of the large scale telemedicine companies, scaling licensed practitioner in each jurisdiction is an impossible task. So they're looking for hacks. I appreciate that. Simultaneously, I would never want the psychologist to be the one that gets stuck with the problem, because they took a shortcut. So my general advice is make sure you're licensed where you're delivering care.
I would add to that, make sure you're insured and have malpractice insurance behind that. And that may help you make some decisions. You need to be the owner and the payer on that policy, and don't rely on some company's policy that may say they're covering your insurance into whatever place you're practicing. So following that line of thought, contact your malpractice carrier to see if you're insured for providing services into those different jurisdictions.
And again, if they are offering your insurance, ask them, what are the limits? What are the features of this? And you may decide that, as Margot's saying, supplemental insurance is advisable.